Yeah, let me bring in Congresswoman Karen Bass, Democrat from California. Always good to see you, Congresswoman. Good morning.
Thanks for having me on.
We mentioned this earlier, 39 Democrats defected to vote in favor of the Upton bill. The National Journal reports some Democrats may even join Republicans' calls for repeal if the problems don't get fixed soon. You're there, you're in the middle of it, you're talking to people. What do you think is going to happen here?
I have a very hard time imagining that scenario at all. And I will tell you that amongst the Democrats that voted for this, and many of them are my friends, I talked to them, and I think that Representative Clyburn had it right on the money when he said that people were insulating themselves. But I just have to say one thing. I've been in Congress now, this is my third year. When I first came in, the Republican slogan was repeal and replace. I've been waiting 3 years. They've had nothing to replace the Affordable Care Act. And so although we're having difficult times, I don't think that the public is looking at the Republicans as providing a solution.
Well, let me play for you the suggestion that was made over the weekend by New Hampshire Republican Senator Kelly Ayotte.
Sure.
The president said that he fumbled the rollout. It's time for a timeout, which I've been calling for, so that we can go back to the drawing board and really talk about bipartisan solutions for health reform in the country.
Is there any piece of this, is there legislation that you think needs to be considered that would be a kind of legislative fix for the woes that we're seeing right now with Obamacare?
Well, you know, I think that there's a lot of things that we could do to improve the Affordable Care Act, but the problem is that if your basic proposal is to repeal, and that was the essence of the Upton legislation. So we're hearing Republicans now calling for fixing the Affordable Care Act, but if you look right below the surface of what they're proposing, it's not a fix at all, it's a repeal. So the Upton bill called for a delay, and it allowed insurance companies to enroll new people without the basic policies of the Affordable Care Act, pre-existing condition, caps, etc. So if they were sincere, I think there's a lot we could get done. I do not think that there is any amount of sincerity in what they're proposing.
There are a lot of Democrats, a lot of supporters of Obamacare who have said repeatedly up until even now that really as long as this does start to get working, as long as people can log in, get registered, this problem is going to take care of itself. Now we see this report in the Washington Post that says by the end of the month, the Obamacare website may still shut out as many as 1 in 5 people. Is that acceptable?
Well, it certainly isn't, but I'll tell you, one of the things that we could do as Democrats is to really promote the parts of the act that are working, such as your previous guest mentioned. Or I'm from the state of California, where you have everybody in favor of the Affordable Care Act, and Covered California is working well. So I think it's our responsibility to promote where the law is being implemented well, and then also to do whatever we can to repair where it's not.
Congresswoman Bass, always good to see you.